News 3 is taking action for your health this morning. Recent research shows a link between the amount of sleep you get and breast cancer.
Now, what does that mean for women who are already at risk for the disease? We bring in our medical expert this morning, Dr. Ryan Light from TPMG at Greenbrier Family Medicine.
So, Dr. Light, how strong is this link between sleep and breast cancer?
Well, there have been multiple research studies out there that show an increased risk of breast cancer related to sleep, either if you sleep too much or you sleep too little. So, getting the ideal form of sleep is about 7 to 8 hours every night.
Why do we think that the risk of breast cancer is increased?
Well, the research is really early, so we don't really know, but we see some scientists believe that it may be related to the brain chemical called melatonin, which is actually what puts us to sleep.
Wow, and so somewhere between, if we're not getting enough of that, it's linked in some kind of way?
Either we're not getting enough or we're getting too much, but it's so early we can't really give you an indication, but we know that it is seeing some causation there.
And so when we're looking at these studies, how much is this increasing the risk for breast cancer, that lack of sleep?
When we look at the research that came out of Britain recently, it said a woman who got the 7 to 8 hours of sleep and got up early was 40% less likely. If you got less than 6 hours or more than 9 hours, you were 20% more likely to have cancer.
That's enough to take notice, to sit up. So now we want to get a good night's sleep. You're the doctor. What do you suggest are some good ways to actually fall asleep and get a good night's rest?
One is avoid napping. You want to avoid caffeine after 5 p.m. Set a regular bedtime. Get up on a regular schedule. You want to turn off those electronic devices, as we've talked about before. And you want to make sure that your bedroom temperature is between 60 and 67 degrees. I don't know anybody that does that one, but...
We've got that one, yeah. Jess and I both have that one down pat. What about those melatonin supplements? What do you think of those?
It's too early to tell, but yeah, there should be, if it's working for you, you can continue with it, but...
Gotcha. Just be careful with those.
A little bit of caution there.
The moderation that we always talk about.
Yeah,
all right, Dr. Light, great information. Thanks so much.